You want to prepare yourself by exposing yourself to as many practice questions as possible while doing this at the same time. So if the maximum amount of questions is 145 for NCLEX, assuming you go up to the maximum amount, then you want to prepare yourself for the worst. So what I did was I did 75 to 150 questions a day for a 2-week period. And I really didn't focus that hard on it, and I still passed my NCLEX exam on my first attempt.
You're welcome, you're welcome. Here's another glimpse in the life of Mr. Seldom, on a mission to heaven so he can tell me well done. He got all my secrets, he promised he never tell none. You're welcome, there's no other feeling like it.
What's good, everyone? It's Jamal Haki, channel dedicated to helping individuals unlock the will to conquer imagination. And if you truly believe in self, as well as the content being posted here on this channel, then we can indeed help turn the you that's you into something more valuable. Now, if you're tuned into this video, then you already know what's up with the content here. We are going to help you on passing NCLEX first try, simple and easy. Now, I don't know what the other people been talking about on their channels in terms of passing NCLEX, but if I know you clicked on this video, then you came to the right place. I'm gonna get you right. Oh! So, without further ado, first things first, we gotta show you something to make it official. Your boy is officially a RN. Perfect. I like to say, man, you ain't officially like a registered nurse until you get your badge, right? You go through the orientation and you signing the paper out and everything, and then you anticipating waiting until your first shift, and then you go for the orientation, you got your preceptor, and you like, yeah, now it's official, right? And if you want to get to that step, then you already know who you should be listening to. Me. So first things first, nice, simple, and easy. I got 3 tips on how to pass the NCLEX exam first try, simple and easy. Step number 1, clinical manifestations. You got to get good at understanding clinical manifestations. I'm going to be real with you. A lot of questions that I've seen during my NCLEX testing practice review, and on top of that, on the NCLEX exam, I saw a lot of clinical manifestations. So what I mean by that is those are the signs, symptoms, or the manifestations of the condition, the things that are the telltale signs of what that particular condition is. See, it's important to be able to identify those things because it helps you prioritize the patient, because you're going to get questions that have clinical manifestations, or you're going to get answer choices with clinical manifestations. The better you become at being able to identify those things, you will better be able to get the answer correct. Here's an example. You're going to see some clinical manifestations in relation to drooling, lethargic, restlessness, maybe some changes in level of consciousness, something in relation to some type of head trauma. Maybe you'll see things in relation to like acute cirrhosis. Reason why I'm naming these particular things is because those typically are the highest priority in terms of a client. So when you see those things as an answer choice, most likely that's the correct answer. So you definitely want to be looking at those things because those start to affect the, your ABCs, as well as changes in level of consciousness, right? Airway, breathing, circulation, and then anything that's going to affect the overall livelihood of the person. You definitely want to prioritize that particular patient. Yeah. Step number 2, you definitely want to be able to look at and really hone in on the rationale. Now, by doing this, it's going to better consolidate your studying, and I'm gonna tell you why. Because let's say, for instance, you got to answer correct or incorrect. It doesn't matter. Regardless, you need to be looking at the rationale. So by looking at this particular rationale, you know that in the future, when you come across a question that's of a similar subject, a question that has similar conditions, dealing with a similar condition, you are at a higher probability of being able to answer the question correctly based off of the fact that you read the rationale of a similar type question, because there's a lot of nuggets in those types of information, right? That's what got me through my whole nursing school program. I was laser beam focused in on the rationales of anything that I missed and got correct. And that better help me for the future questions that I was going to be answering.
You think I'm playing?
And the third and final point, you see, we're going through these nice and simple. We ain't playing around with this video. Also, this is like my 5th time recording this for some dumb reason. But the third and final reason, right? About 80 to 90% of people who have passed their nursing school program will pass NCLEX exam first try. I'm gonna explain why. So over here, we like to get into probabilities. I'm a statistics type person, factual type person. I like to live in reality. Reason why I say 80 to 90%, I want to be a little bit more conservative with my numbers, is because in order for you to even pass your nursing school program, you probably had to take some type of final exam, some type of exit exam, right? To be able to, for the school program to be able to see you as someone that is competent enough to take the NCLEX exam. So if you was competent enough to be able to pass your exit exam, on the balance of probability, that exit exam most likely is harder than the NCLEX exam. If you don't believe me, check online to prove this information. And also to be able to verify why I believe 80 to 90% of people will pass their NCLEX exam first attempt for people who went through their nursing school program is because for using certain programs like HESI or using ATI or using things like UWorld, it tells you a percentage of people that pass the NCLEX exam first attempt. For example, for ATI, about 90 to 96% of people pass the NCLEX exam first try after they finish doing like the VATI or they finish doing their predictor exam, depending on the score that you get. Another example, for people who do UWorld, if you score anywhere between like a 54% to a 55%, you're at about close to a 92% chance of passing your NCLEX exam first try. So when you're looking at these statistics, it means that you have a higher probability of being able to pass your NCLEX exam. You may not feel comfortable, but try looking at your stuff, that the scores that you getting. You may be overshooting something, or you may be overlooking something. Chances are you probably comfortable. You probably sitting real good on the scores that you're getting. And the final point I want to list, then this is still part of the third and final point, is that you want to prepare yourself by exposing yourself to as many practice questions as possible while doing this at the same time. So if the maximum amount of questions is 145 for NCLEX, assuming you go up to the maximum amount, then you want to prepare yourself for the worst. So what I did was I did 75 to 150 questions a day for a 2-week period. And I really didn't focus that hard on it, and I still passed my NCLEX exam on my first attempt. So if you someone that want to be able to laser beam focus in on the material that you're studying, try expose yourself to as many practice questions as possible. I didn't read any books, didn't look at too many notes. Laser beam focused in and lock in on practice questions from whatever program that you're using. ATI, HESI, UWorld, you name it. Whatever's going to get the job done, focus in on that. Oh! And that's pretty much it for the video, guys. This is Jamal Haki, channel dedicated to helping individuals unlock the will to conquer imagination. And the thing that I like to say over here on this channel, quality questions lead to quality answers, which then leads to quality results. And if you truly have a quality question, be sure to leave it in the comment section. I may indeed have a quality answer for you. Until then, I look forward to seeing you guys on the next video. Make sure you leave a like, subscribe, and hit the bell to be notified. Until then, peace out!
It's the act of God. I used to act the fool, but now I act in movies. Actually, I'm just making moves. We still making music. Tell you about my past to secure my future. I'm all in my bag. Flow like a computer. That's a humble brag.